welcome to the Device Files Commercialization Confidential. I'm really excited today because my first guest is Kate Dilligan, who was a medtech innovator with me back in, was it 2021?
Yeah, forever ago.
I know it does seem like forever ago, but it really, well, maybe, okay, now it was 5 years ago. Okay, fine. Uh, and your company, Cooler Heads, has really been going gangbusters ever since then. Let me introduce Kate really quickly. She is the CEO and founder of Cooler Heads. They make Amma, which is a really awesome product that lets chemotherapy patients keep their hair. It's a scalp cooling technology that allows patients to keep their regularly scheduled appointments and optimizes workflows for providers as well. And they sell to cancer centers and infusion clinics throughout the US through a direct sales force. And I think also a distributor partnership with McKesson.
Yes.
Am I getting that right? So you guys launched at the end of 2022.
Yep.
And since then, you've really been growing a lot. You doubled your commercialization footprint last year. That's awesome. And one of the coolest things about their growth has been that you guys generally end up with three-quarters of your customers being completely new to scalp cooling. And I find that to be very, very interesting. Must also make for a little bit more of a struggle getting set up in the different locations. So thank you for being on the show today, Kate. I really appreciate it. And you told me right before we started filming this that the plan that you originally had on paper isn't necessarily the way that you are commercializing now. Can you tell me a little bit about that?
Absolutely. And even when we were back in MedTech Innovator in 2021, I originally designed Amma to be a DME product. So originally our thought was is that we would have a fleet of tens of thousands of these products that we would rent to chemotherapy patients for the duration of their treatment. But as we got closer to commercialization and really started digging into the gross margins of that and the upfront costs and really creating that massive fleet that we would need to launch, rather than tying up one machine with one patient for the duration of chemotherapy. So I'm going to give a quick scalp cooling primer for everybody listening so you can really understand what this technology does, because most people do not know that you do not need to lose your hair from cytotoxic chemo. We're still a little bit in the redheaded orphan stepchild phase of really making sure people know that scalp cooling should be an option to the vast majority of patients that are undergoing chemotherapy. So what scalp cooling is you bring your scalp temperature down to 65 degrees continuously before, during, and here's the kicker, several hours following chemotherapy. That several hours following chemotherapy has been what has made this therapy hard for most infusion centers to adopt because they build their infusion centers, whether it's 10 chairs or 100 chairs for a certain number of expected patients in a day, because if they've built the infusion centers, they know how many cancer patients or patients with other chronic diseases requiring infusions that they will need to see. So then, if you essentially double the time that a patient is in an infusion chair, that's simply a non-starter. And so even though we have the category 1 codes for scalp cooling that have started as of January 1st of this year, which is awesome. So Medicare is now covering scalp cooling, which is so exciting. But even with that, most infusion centers are like, hey, we have too many patients that we need to see in a day. Like we can't work this into our workflows. And secondly, the reimbursement from scalp cooling ain't the same as what you're going to get for like a medical treatment, whether it's chemotherapy or some other kind of infusion. So with Amma, and this is one of the many things we have patented in the product, it's portable. So when patients are done with their chemotherapy session and they have several hours of scalp cooling left, they go someplace else.
That's
So
awesome.
originally there was such reticence at infusion centers, and I always kind of had a long-term goal of getting into infusion centers, but originally we thought this would be a DME product where we'd be renting directly to patients. But as we got closer to commercialization, started really talking to infusion centers, saw that there might be an opening, and then category 3 codes came on board, which are more tracking codes and don't guarantee payment. But that's when we're like, okay, it's time to shift our business model.
Very, very cool. Very interesting. I do remember your pitch back in the day and it being very sort of individual patient, they can take it home with
Correct.
them focused. So,
Correct.
yeah.
And so now
Okay.
rather than tying up one machine with one patient for the 3 to 5 months that patients go through chemotherapy, an AMA unit can treat 2 to 3 patients a day. So it's also way more efficient for us.
Great. walk me through your timeline from when I saw you at MTI to getting your clearance and sort of what were your first steps to get going on commercialization?
So we got our clearance right after the big conference in Minneapolis that we had. I guess it was the end of September of 2021. We were cleared by the FDA in October of 2021, which was really exciting. So I had a product that I could legally sell. We built, 10 prototypes. We'd done all the EMC testing and all the compliance. But like now it's like, okay, next step was that sort of valley of death that's very common in med device. Now we had to do manufacturability. And that hadn't been a priority because as a first time solo woman founder who founded this company because I was a cancer patient, I was very much shepherding my resources to get to each of the next milestones. So then once I got the FDA clearance, it was raising another round of seed dollars so we could do that manufacturability component of it, get it to the point where we had a product that we were ready to launch with patients. In the first units that we had that out in the field, the casings of them were legit 3D printed. Again, past all EMC, all these things were completely
Gotta
safe
do
for
what you gotta
patients,
do.
but you got to do what you got to do. And before, we went to injection molded parts and all these other things that were going to require investments of hundreds of thousands of dollars, we're like, let's learn what we don't know up front. And so we did we did a period of time where we had in the state of California a home medical device retailer license, which allowed us to act as a DME, which allowed us to, lease the machine directly to patients. So our first, 10 patients, maybe 15, were mostly in San Diego, were patients that we provided the machine to that we really, that we were learning from. And they all knew that they were our first patients, but they didn't have access to this therapy any other way. And they were happy to do it. And whatever, we were very transparent. And so by the time we launched our first accounts, at the end of 22, we had a little bit of muscle memory from already starting to learn what it was in the product that needed to be improved, or how do we install it? How do we support patients as they're going through it? Because until you've done it, you haven't done it.
Oh, yeah. I mean, piloting is such an important part of it, and I think
Mhm.
so often people think they're just gonna jump right into those sales, and it's gonna be like a trajectory straight up from there, and they don't realize how much they need to learn in each step of the process, for sure.
And so a really key component of that. So in the summer of 22, when we were enrolling our pilot patients, Courtney Turek joined our team, who is leading our commercial team. And Courtney and Ryan Denny, who at the time was our chief commercialization officer, he still is a very good friend. He's moved on to be a CCO of like a series. I forget if they're C or D company, but like he really it was Ryan and Courtney though and me working together throughout that pilot. And then it was having these extremely experienced med device sales professionals going out and just starting to canvas. So one of the things that I did is like early on, and advice I would give to other med device founders is if you can get physician or like stakeholder investors that are in your area. So I have a lot of medical oncologists that invested in my early seed rounds. And so I had obvious places to go for like first contacts and be like, could you introduce us to your infusion manager? Like who runs your oncology services line? So you had first places to go to start building those relationships. But like throughout that whole piloting process, it was really having Ryan and Courtney going out and canvassing and doing those early meetings and kind of figuring out what the reaction to the product was going to be. They landed our first few accounts. So we're at the end of 2022. We've generated some revenue, Yahtzee. Well, then in Q1, because we knew we were going to raise another round, they identified three capital sales reps, two of which were still with us and who are now our AVPs, our area vice presidents, Caitlin Galvin, who runs the East, and Brian Chrisman, who runs the West. They joined us like in Q1 of 2023, where we maybe had three accounts. We're very private about our customer list and these kinds of metrics. But let's just say we're exponentially, significantly larger than that. But it's Brian and Galvin that really have built this and have been there through the ups and the downs. And so, really focusing early on who are the people that can sell this thing. And obviously, I was super involved in early sales, but to get investor credibility, like founder sales, okay, like you really believe in your product, but can you attract sales talent? Can you keep sales talent? And also, where's the recurring revenue? So by the end of our first year, again, we'd done, exponentially more than we did in, like our, first rumblings of 2022, but we were also starting to see repeat business. So our business is we have a machine that provides the cooling, and then each patient needs their own capping system. So, oldest thing in the book, it's a razor blade model or capital disposable is very common. So, when I say disposable for our capping system, the patient uses it for each of their chemotherapy infusions, which can be normally between 4 and 16. We do have some patients that are on chronic chemo, but think of it very much as razor blade or capital disposable. So as we started to, and so like the questions I was getting asked about investors were, are there reorders? Were all there reorders? Because just because you sell it doesn't mean that it's not just going to sit in a corner. Like like med device is strewn with the corpses of electronics that are in some corner in a hospital. That's like, why do we have that thing again? Because the
Yeah.
champion who really wanted it moved on to another hospital and nobody else cared, and so it's just there. And so the thing that we're really excited about, and the thing that we've really capitalized on and dug into early, was not only, our really experienced sales team, but having also an outstanding leader of customer care, who's a woman named Julia DiVincenzo, who actually was my nurse navigator when I was a breast cancer
Oh, that's
patient. And
awesome.
she's now leading our clinical team. So she actually stood up, she developed a breast navigation program at Sharp here in San Diego. So she's essentially developed what I call the scalp cooling navigation program. Breast cancer
Very cool.
navigation or cancer navigation is something that's very well known in the space. So having Julia setting up our scalp cooling navigation, and she leads a team of that customer care, and that going out in the field was also a big differentiator for us. So, really since MedTech Innovator, it's been figuring out how do you build this stupid thing? And then how do you sell this thing? And then how do you support your customers to develop a true scalp cooling program rather than having it just be, again, something that's in the corner. And if a patient insists on it, how do we get it to a point where clinicians, as they're telling patients they need chemo, whether it's breast cancer, colon cancer, pancreatic cancer, they're offered a choice. And that's really what we've been focused on.
Oh, man. You know, one of the things I love about what you went through here is it's so easy for someone to come on a podcast and talk about everything they've done that's so amazing. And you really take time to talk about your team and everybody and how they work together to get it done. And I really love that.
I have a Stanford MBA. I have a career in tech. I had never done med device. I had never done hardware. I had never done any of this stuff. And so for me, the feedback I got consistently is from investors until I'd say the last 2 years is we don't know that you know what you're. It is the oldest thing in the book, and we were told this by that MTI, you're told this at all the startup accelerators, but it's really true. Who is your team and who on your team has done it before? I had not done it before. It was extremely important for me to find people that would join the team who were like been there, done that. And then also what investors like to see, proving here's people that can work together and can build teams together.
Yeah. Like you said, you've been getting some exponential growth, which is amazing. Do you think there was one moment that really unlocked sort of, yes, we have a model that works and now we know how to execute on it? Or was there one contract or something where you really where it kind of clicked together?
There was one account that really showed us that we knew how to do this. And so I'm going to name a specific account because we've been highlighted in a bunch of news articles in Pittsburgh as being their scalp cooling provider. So UPMC was an early account. And at the end of our first year, we'd started out with, and again, I won't get into specific numbers, but they'd started out purchasing a certain number of machines and a certain number of caps. And what we saw by the end of the first year, we went from 2 infusion centers to 4. They kept reordering. And then by the end, and then once we got into 2024, all of a sudden we were at 7 infusion centers and they kept, and we're still growing. at UPMC. And so it was seeing this growth at UPMC and kind of having that proof point. And again, hat tip to Courtney and Caitlin Galvin, who really developed relationships, went deep. I'm not saying it was perfect from the get go, but we were
It
always
never
there.
is.
We were always listening, but we were always really responsive. And so what we did is we developed trust. And so being able to develop trust at a flagship account like UPMC is so important for us. And again, not going to name names, but we demonstrated that model over and over and over again. And our first few accounts were smaller health systems or were private practices. And again, wasn't perfect. We always went in though trying to learn. And so really figuring out how you work with a major medical center and stepping back at the end of 23 and then looking back again, mid-year 24, end of 24 at everything that we'd accomplished at this one account really kind of showed what going deep at an account could look. And so that's when we knew that we had a repeatable business model.
So what does it really take to get in with a major medical center?
It's the oldest thing in the book. It's finding the right person, right? And so again, I started out working on getting investors that were medical oncologists. And I'll take it even a further step back. So my first career before I went to business school, I was a political fundraiser. And I was a political fundraiser right at kind of like the dawn of the digital age. But the way that I would raise money for my candidate is I would find a supporter who was a prominent business person or an attorney, or they were some kind of stakeholder. And so they were supporting my candidate for a particular reason. And then I would sit down with them and I was like, who else do you know that shares these concerns, whether it's ideological or they have a business issue in front of Congress that my member of Congress advocated for? So they had a different financial reason. Who else should I call? And just going through list by list. And so we called that back in the day, kids, this will break your brain. We called it Rolodexing, going through and asking name by name, who else should I talk to? Who else should I talk to? Who else should I talk to? Doing that with our early stage investors, having Ryan and Courtney, do that within their networks, starting to go to trade shows, just building those relationships. And then me having, been pitching Cooler Heads for more than 4 years, not only having other investors who weren't even medical oncologists or somehow involved in oncology, but like they know somebody who's the head of a hospital that can make an introduction. And it really is just building out that network and finding who those stakeholders are. And so there's the person that can get you into the first meeting, but then it's understanding who's the decision maker and what is it that they want to see. And so for us early on, establishing UPMC as a reference account was really important, because then it's like, because you don't get your 11th account until you've gotten your 10th, and you don't get, your second academic center until you get your first. But if your first major academic center is willing to give you references, that's very powerful.
Yeah. So you talk a lot about the people you need to know, and yeah, that is very important. You mentioned at one point, was it an infusion manager? I mean, when you go into these hospital systems, is it somewhat standard, the types of roles that you're
No,
looking for, or is it always different?
it's similar, but it definitely is different. We have several health systems that are nationally known where it's the nursing executives that make the decisions about scalp cooling because it's considered palliative care. It's very much though is care. Other health systems where it's the VP of oncology or whoever is sitting over oncology writ large, not just like the head of oncology as a medical oncologist or whoever's running, whether it's a surgical oncologist, not just the medical lead, but the business lead. So it really depends health system to health system. But we found having support not only of the medical oncology team, but of the surgical team, and then getting the nurses on board is a very big deal. So being able to have Julia, who leads our clinical education team, our customer care team, having a nurse navigator on our team, like really understanding nursing workflows, I
Yeah.
think has been a real value add for us.
Yeah, that's excellent. That's so often people think it's just a medical device and we sell it to the surgeon. And they don't think about all the other examples out there. And certainly oncology is one where the nurses are such the front line of that. They might not totally get the final say, but they certainly have a voice in the room that's a lot bigger than in some other situations.
Well, and the difference also with scalp cooling is so, when you're diagnosed with cancer, again, as somebody who's had that really crappy news, It is a life-altering event, and many people do what I call cancer shopping, and so you go and get a second opinion. And so where are you gonna get care? Are you gonna get care someplace where they're gonna offer you a whole suite of services, a whole suite of treatments outside of just, like, your core, the core of what you're going to do to, hopefully eradicate the disease? Because what we're seeing is a lot of health systems are now, again, that stat that you use, over 75% of our accounts had never offered scalp cooling before until we provided them with a way to get the patients out of the chair so they're not changing patient scheduling, is it's a competitive advantage for
Yeah,
them. And so that's why
absolutely.
a lot of times I'm talking about it's, the VP of oncology or somebody who's sitting across oncology as a business unit being like, well, this can be a competitive advantage if a patient goes to us versus someplace else. I don't know if people make a decision about where to get a knee replacement based off of the tools that the orthopedist is going to use or what kind of, implant they're going to get. I do know that, people they've sold Da Vinci as being a way to go and get certain kind of laparoscopic procedures done because you'll have faster recovery time. But like with Amma, it's something where patients actively, like we have patients drive hours to get care someplace else because they want to keep their hair and they want to use Amma. And that's really important for us. And it's very different though from a lot of traditional med device sales because we're something that a patient actively opts into. And again, if you're getting a knee replacement, you're going to use a certain set of tools, you're going to use a certain set of implants. Like the patient isn't choosing. With us, the patient is very much opting in.
Yeah. Yeah, very interesting. So, we want to go through our top 5 takeaways, and we have covered so much all. Now we can kind of rapid fire summarize what our top 5 takeaways are now.
I think, a lot of it is what we've covered, getting to operational credibility. And so for me as and I think that that goes back to the stories I was telling about building a team of experienced med device professionals. That for me as an entrepreneur was operational credibility. But again, looking at UPMC as a flagship account, operational credibility, having people there. Medical device and, medicine is relatively a small field. So if you're selling a particular surgical implant, the surgeon that used it, if they loved it and they're at a conference, they're going to say, oh my God, I'm just using this new tool and it's the best thing since sliced bread. Or like, oh my God, this company tried to sell me this thing and I tried it and it was an absolute flat out disaster and the customer service was garbage. So just know, everybody talks sales discipline. And that really, again, is really focusing in on building that pipeline, relentlessly building that pipeline. And we do that from a commercial perspective, but I certainly also do as an entrepreneur from an investor perspective, always talking to funds about the next round, always talking to funds about, well, these are the milestones we're about to hit.
You had your written commercialization plan before. And
Hmm.
now I'm sure you make other plans now that are more sales and tactically focused. And
Hmm.
so when you think about what your sales discipline is now, what kind of planning and documenting and mapping out, what goes into that process now?
Oh gosh, so much. So, I mean, we have everything from, the economic analysis about, median household income per zip code to also, we're now navigating these really exciting waters from category 3 codes to category 1 codes. And we're very fortunate in that not only is Medicare covering this, but there are private payers now that have issued coverage determinations, which is a
That's
very big
awesome.
deal, as well as in the states of Louisiana and New York. They've passed legislation that certain health plans in those states have to cover scalp cooling. So there's now
Great.
legislative imperatives. In 2 states, there's moving legislation and more to get this covered. So the planning that goes into it is obviously, we get a number from our board and then we break it down by territory based off of what we call the run rate. So in a particular geography, what did our accounts in California do for recurring revenue this past year? What would then be 30% growth on those existing accounts, plus what other accounts are in the pipeline to get to what that next growth number would be? And sales reps that not only are responsible for nurturing accounts and maintaining their accounts, but landing new business. And again, we've developed a user-friendly, easy to use system. We have super users at the health systems. So it is very feasible for us to be doing business reviews and to have a high touch relationship with those accounts as we land and get up and running new health systems. Moving to these category one codes, several of our accounts have decided they're going to pre-purchase much larger numbers of caps through distributorships. So getting heads up into that planning, because again, we're still a young company. Like we're going to raise our Series B soon, but like I'm not Walmart. I don't get to do just in time like Toyota. So if we're going to, as we really start to see, like last year, our recurring revenue was like almost 400% growth. And so as we try to really get a handle on what it's going to be this year, I can't react to that from a supply chain perspective that quickly. So really that sales discipline is really cooler heads discipline because it takes us a couple of months from sourcing to getting the different components to getting the cap systems built and shipped up. And it's not that it's, the most complicated thing in the world. It's just the way we've made it a high margin business is doing it this way. We're looking at our next gen product. We're looking at lots of other things, but really having that tight coupling to the sales process and really getting good at forecasting has been really important for us. Because for us, the unforgivable thing would be to have an account that has a robust scalp cooling program and then not being able to supply them with caps.
Yeah, that's a good point.
So, next thing, hard decision. So that pivot from this, DME to, selling to health systems to, but hard decisions mean all kinds of things. Like, do you have a sales rep that isn't working out? Is your training module just garbage and you just need to throw it out and start it over again because you release something out into the field and it's just causing confusion? Like,
Yeah.
really keeping a temperature and having leaders at different aspects of the business that can flag when things are or aren't working. And also, like we've had some health systems now who would be like, well, we would like to pilot the system and we don't want to sign a contract. And we're beyond that. Like, I don't need to do that anymore. And so, no, do you want in or not? And so being able to make those hard decisions, like what is a good use of our time and what is going to move the needle and get us to that number or get us to those goals that the board has set to us and what's a distraction. Um, and then relentless follow through. And any entrepreneur is going to know that, whether that's fundraising or again, with some of these major health systems that are accounts that are really complex, that have a lot of stakeholders, us being the customer service first. And we've had instances where things go wrong within the first two patients, but because we were so hands on throughout installation, they said there was a problem, we fixed it, we apologize, we're on it. And they're like, you know what? We want to work with you because you're
Yeah.
demonstrating early on that you'll be there and that you'll be sticky. And it's not like, here's the product, go with God. No, we don't do with that. And then for us, one of the things that has been hugely helpful in the last 14 months really is, learning in October of 24 that we were getting the category one codes because that really changed the conversation and really helped accelerate the growth in the pipeline. Because for us, back to like my example of a knee replacement, people need knee replacements. And so you're going to need these certain surgical tools. You're going to have to make a decision about, the implant or whatever the implements are that go into a knee surgery. For us, for scalp cooling, the largest competitor is just not doing it. Like, we do have competitors, but the other option is like, and there are some kind of garbagey over the counter solutions. I used one of them. I spent more than $8,000 to keep my hair. So the alternative is to do nothing. And so being able to go to health systems and being able to show them the National Comprehensive Cancer Network guidelines that has scalp cooling as a two-way recommendation. And now this is covered by Medicare patients. And here are the private payers in, the counties around your health system that are covering it. We're working, again, we have an awesome VP of market access working to bring on more private payers. Like this is something that you should be offering as a strategic advantage. So that's been also something that we've really been hammering.
Yeah. And we talk so much about the need to figure out the reimbursement early on, but also, I mean, to a certain extent, you guys got a little lucky on the fact
Hmm.
that they've, updated these codes. And, sometimes it's persistence, sometimes it's kind of knowing which way the wind is going to be blowing.
Hmm.
You know, I think if you have a product that patients, a lot of times the nurses want,
Yes.
ultimately it will get there. But the question is how quickly, right? So,
Yeah. And I mean, and for us, it was really starting to see the change in the medical literature, the change in the NCCN guidelines. And again, I'm a breast cancer survivor. I spent 8 grand to keep my hair, and it wasn't a beauty thing. It was a privacy thing. I worked all throughout chemotherapy. Like, not everybody that gets cancer goes on medical leave I was diagnosed in October and I didn't finish treatment until July. And I was not in a position to not work for 10 months. Like, that simply wasn't in the cards. I worked all throughout chemo. And do you know what? I didn't want to talk about the fact that I was a chemo patient at work every single day.
Right.
And so I didn't have to. I could tell who I wanted to tell. And so scalp cooling, it's not about beauty, it's about controlling the narrative. And that is equally important for men and women.
Yeah, that makes sense. That makes sense. Well, I love your 5 takeaways, and
Hmm.
it's been really awesome hearing about your growth and everything that's been going on. We're gonna do a lightning round now where
Sure.
we ask a couple of questions. Let me grab the questions, make sure I have okay. Looking back on your progress to here, what's one thing you would absolutely recommend someone else do if they were commercializing in your space? Like the one thing you would do again?
Hire, bring on experienced salespeople. It's finding salespeople that share the vision, that share the passion, that are going to bring that credibility to you. Because founder sales are, again, are important. But if you can demonstrate that you can bring on sales leadership, that provides a lot of confidence.
That's a good point. Okay, and what's one thing you would never do again?
Would never not prioritize quality. I'm talking about when we were working with a third party design house in the very, very, very early days. And it's not that they didn't have a quality focus, but I should have been well better educated on the quality process in medical device because it would have saved us a lot of time and money. And I would have been asking better questions early on. And we would have probably gotten to our 510(k) submission faster.
Are you one of those teams that realized later that you didn't have a design history file and had to kind of go back and rework it?
Bit of
Sort
that,
of like that?
but also just sort of maturity of some of the documentation,
Okay.
but again, and it's not that they're bad because, like, they're a great team and I have the utmost respect for them, but it was my not being educated enough as a founder, and also, like, this is also going on during COVID, so, I couldn't be that
Yeah.
hands-on and couldn't be in person as much, and so I should have gotten much more educated on that now, and now we have an absolute baller director of quality, Sarah Hidman, who's leading the charge.
Nice. Okay. Which KPI is your favorite KPI?
Patient enrollment.
Okay. Easy. What was your most unexpected growth lever?
Yeah, it wasn't our most unexpected growth lever was also, like, it's kind of like it also proved me right. It was, word of mouth of patients at accounts,
Okay. Yeah.
and I had posited that it would be, and so the fact that I got proven right, it was wonderful to be proven right on that
Yeah.
one.
Too bad you can't get a KPI for that one,
Yeah, exactly.
right?
Nobody cares. I was like, because, like, again, I was the patient, like, I understand the way these people think because that's the way I thought in 2016 and 2017.
Yeah. Yeah, exactly. Okay, I know we covered that your commercialization plan is sort of a DME selling straight to the patient was a little bit of a shift, but was there any other big assumption in your original commercialization plan that just turned out to be completely wrong?
I thought that it would be easier to raise money. I thought that it would be a much straighter path. I thought that I would have more resources to invest early on. And I learned very quickly that demonstrating what you can do with spit and baling wire was ultimately the most important thing. Because if you can prove you can do it with no resources, that's how you get resources.
Yeah, that is very, very true. That is so true. Okay, so looking forward, what's in the future for Cooler Heads?
We're going to be releasing a next generation product end of this year, beginning of next, which is going to be transformational for patients, which is really exciting and going to be continuing to grow. We have some new hires on board and major accounts that we'll be announcing. It really, for us, the next focus of the next 2 years is private payer reimbursement and addressing the challenges with Amma, making Amma even easier to use so we can really continue this really fun hockey stick.
Nice, great. For anyone listening who is about to launch a device in oncology or specialty care, what's the one piece of advice you would give?
Have deep relationships with your end user customer. And so for us, we have two, which is the patient, but really focus in on whose problem are you solving? Because in oncology, is this a problem for the medical oncologist, or is it a problem for the nursing team, or is it a problem for somebody else down the road? Really understand whose problem you're solving and be very close to them and have ongoing communication with them.
Okay, and where can people learn more about what you're doing?
Coolerheads.com.
Easy.
Very really, really easy. We did a whole revamp of the website. I really would encourage people to check it out if they want to learn more.
Awesome. Kate, thank you so much for joining us on today's podcast and for being my first guest. It was fascinating to delve into your story with Cooler Heads and Amma. And for everyone listening, you can find the links to everything we discussed in the show notes, including how to connect with Kate and learn more. This has been our first episode of the Device Files Commercialization Confidential, which is part of a Substack publication where I dive deeper into medical device and wearable commercialization strategy. You can just subscribe at my name, Blythe, BLYTHE, KAROW, at substack.com for more stories and analysis. I'm Blythe Caro. Thank you for listening, and I'll see you next episode. Okay, we're done. And
Yay!
we'll see what happens when I try and figure out how to edit it.
Did you get what you want?
Oh, yeah, absolutely. This was great.